took the test myself yesterday, scored a 50, so you guys can do good. You guys are all younger, faster, stronger, better, smarter, better looking than I am, so you got this. Alright, so we're gonna run through some stuff here. Again, this is by no means intended to be comprehensive, right? This is just kind of give you some guidance as you study certain areas you may want to focus on. Okay? Which is everything. Alright, so IDA, right? Iron deficiency anemia, plain and simple. You just gotta know it, right? Something you're gonna see in primary care. What does it present like? What does the labs look like? What is my CBC? What are my iron studies? Okay. What are the hallmarks of the disease? How am I gonna diagnose? How am I gonna confirm? How am I gonna treat? Thalassemia, same kind of deal. All of this stuff, and they all present, right? So again, this class is all about anemias and everything. So a patient that's tachycardic, short of breath, pallor, whatever, is probably anemia in some fashion, and then you're gonna have to figure out what that looks like. Mentor index, good. Anemia, chronic disease, we'll talk about it a little bit more today. Just again, I want to reinforce that mechanism of the anemia of inflammation. Right, what's going on with anemia of inflammation? Hepcidin, what's the hepcidin doing? Right, so again, right, it's reducing the ability for the body to absorb iron into circulation. Right. Whatever iron you have in storage, and iron in storage is what? Ferritin, right? And it's locking into ferritin. Alright. B12 folate, you guys got that, right? Microcytic anemias, megaloblastic anemias, differentiate into two. What's evidence of hemolysis? All of the above, right? So know the labs that's going to be symbolic of hemolysis. Alright, and the patient that you suspect presented with jaundice may be an indication of hemolysis. G6, yeah, you got it. Sickle cell, sure. Von Willebrand's, right? Know the mechanism behind von Willebrand's. What does von Willebrand's present like? Again, all this stuff, what does it present like? What are the hallmarks? How am I going to treat? How am I going to confirm? Right. ITP, it's in the name, right? Isolated. It's only the what's that's affected. Platelets, all right? And then again, fall back on the names. What's MAH? What does that stand for? Microangiopathic hemolytic anemias. Go back to the names, right? And just figure it out. All right. Yep. Differentiate hallmarks of HUS. What's HUS? What's going on? Patient population that you tend to see that in. Kids, right? They had some sort of whatever, febrile illness, yada, 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 end up with diarrhea. Right? What's the mechanism behind HUS? Sugar toxins, E. coli, yada, transfusion we talked about the other day. So again, hey, break them down. You have hemolytic reactions, non-hemolytic reactions, right? When do they present? What's the timing of presentation? All right, hemophilia A versus B. How do you distinguish the two? Right, you can factor assay, they present similar. You can't tell just by looking at a patient. Yeah, the hereditary thrombophilias, VT, DVT. Right, so T's are confirmatory tests. Anything that has a confirmatory test, know your confirmatory test. Have to be able to interpret labs. If you cannot interpret labs, you will have a miserable day come Tuesday. Which means I'll have a miserable day. So I'll have to make everybody's life miserable. Right? Labs, give you the diagnosis, yes. WBCs, yeah. We didn't really get into a lot of WBC stuff, right? This is oncology stuff. Alright. Again, run the traps, walk the dog on this, right? Hey, you get your CBC back. What are you looking at? What are you looking at to determine anemia? All right, your H&H, hemoglobin hematocrit. Then from there, what you are gonna look at? So if you have the retics, you can look at the retics. Real world, you often do not get your reticulocyte on a CBC. You got the MCV every time though, right? So you take a look at that MCV and take it down your pathways, right? Micro, macro, normocytic. Good. So some people memorize the crap out of this chart. If you're able to walk through and understand the pathophysiology behind the disease process, you're way better off than trying to memorize this. Right? We'll hit the simple one first. Iron deficiency anemia. I'm iron deficient, so my iron is obviously what? Low. What's my iron ferritin? My storage is what? Low. All right, the body wants iron, so what does it do to transferrin? It increases, it upregulates your transferrin, right? Because your iron is low, your transferrin saturation is low, right? So if you can talk yourself through that process for the disease process, you're good. If you can't talk yourself through it and make sense of it, you need to come see me before Tuesday, right? All right, and on this confirmatory test, yes, be familiar. Be able to walk through those. Macrocytic, same deal. Megaloblastic versus non-megaloblastic. What's your cutoff delineation size, right, for macrocytic? And what's the difference between a megaloblastic versus non-megaloblastic? Right? And then can you differentiate a B12 versus a folate deficiency? Right. MMA and then, all right, there it is. Right. So again, be familiar with. Gone through these. Same deal, retics, yes, right? Telling you hemolysis or hemorrhage, good. Anemia of chronic disease. One more time, just so everybody's tracking. Don't confuse yourself on this. Anemia of chronic disease, anemia of inflammation specifically, upregulates your what? Hepcidin, which is gonna do what? So, once that upregulates, it stops the body from absorbing, right, the iron into the circulation. And any iron that's locked in the system as ferritin is one that keeps it as ferritin and not allow it back into regular circulation, right? So your iron, your circulatory iron goes down. What happens to the iron that's in storage? Yes, they're the same, right? Maybe also a little bit. What happens to your transferrin? Down. Down or normal. The body does not want more iron. Right? The body's trying to keep the iron away, so it does not upregulate, like we saw in iron deficiency anemia. Right? Iron deficiency anemia, what happens to your TIBC? And iron deficiency anemia? It goes up. Right? Here, the body does not want more iron, so the binding capacity low. Right? All right. Again, be able to walk the steps on that. This, you guys got this all memorized already or tattooed on the back of your hand. Again, know the mechanisms, know the effects. Who cares? Who cares? Who cares? Who cares? Who cares? Question. All right. Read that. Should I be worried?
Should we just trust you on this?
Well, you might care, but you know. All right, 28-year-old female. Chief complaint, fatigue, muscular weakness. Fatigue, muscular weakness in this class where we're talking about anemia is probably a what? It's probably anemia. What's your most common anemia? Right? What's your hemoglobin in your crit telling you? She's anemic. What's the MCV telling you? Microcytic. And again, take your pick. Most likely, all right? Good, good, good. 13-year-old, somebody, right? Yes, sure. Right, you can start picking stuff out, right? All right, so maybe some worms in his stool. There's his labs. Hemoglobin. What's your hemoglobin telling you? Low, so he's anemic. What's your MCV telling you? Microcytic anemia. You know you're dealing with a microcytic anemia, and the eosinophils are associated with what? Parasites, right? They already said he had worms. In addition to treating the infection. All right, so what's your diagnosis? What does this kid have? Okay, well, this is not parasitology class, right? So if you start answering parasites on your test tomorrow, you're gonna have a hard time, right? Hey, and then you guys have been here for a long time. You're experts at taking tests, right? Don't start picking crap that we didn't talk about, right? So when you see something on the test about somebody with leukemia, I don't remember talking about leukemia in this class, right? So don't do that to yourselves. Right? All right, so what's the diagnosis? You got microcytic anemia, IDA. How do you treat IDA? Wait, is that what we're talking about? Yeah, let's do this one. This is a good one. All right, what do we got? You got a macrocytic anemia. How do you know that? All the keys are there, right? So you got a macrocytic anemia. Next. What's your differential diagnosis for the macrocytic anemias? B12 or folate. Which one is this? Folate. Why folate? Winner, chicken dinner, right? Again, 5 months. Storage of B12, years worth of storage. So it's gonna take years before you have a problem with B12. Your body's ability to store folate is limited. So you're gonna see a folate deficiency way before you see a B12 deficiency. Everybody good? If not, please get there. All right, this is a classic type of what a test question looks like. Bunch of words on a page, I throw some labs in the middle of it, and then I say, all right, figure it out. See if I know what this is. All right, so what do we got? Diagnosed with B12. All right, you did the right thing. You started this patient on B12, on some oral replacement, came back later on, drew the labs. What are we looking at? What's the labs telling us? Anemia. Macrocytic anemia. What's the iron studies telling you? Are you concerned with the iron? All right. So macrocytic anemia. You did iron studies, whatever. Folate and B12. What's this telling you?
Still not getting it.
So folate's normal. B12 should not respond to treatment. What does that indicate to you guys? So what's the right answer? All right, intrinsic. All right. If you can walk through that, you'll be fine. What is the iron studies telling you? Who cares? All right. Who cares? It's a macrocytic anemia. We don't care. So sometimes there's labs on a page that might not add anything to your right, but that's real life. All right. Nobody cares. Nobody cares. Nobody cares. Nobody cares. Nobody cares. 26-year-old. No. 6-year-old. No. All right. Female airman. We call packed RBCs. Yep. Sure. All right. What do we got? Somebody got some blood. Okay. And then what's the patient exhibiting? While on the table, experience sudden onset bleeding, nose, mouth. What's that bleeding associated with? Think of the stuff we talked about. Look at your, right? So one way or another, this patient had a transfusion, and we know we're dealing with one of the transfusion reactions. Fair? They're bleeding. What does that indicate out of all of these things? Hemolysis. They're bleeding. Hemolysis. All right. So now go do your test taking magic. All right. Y'all experts at test taking, and you can weed the stuff out that has nothing to do with hemolysis. So what are you left with? acute, delayed. What's your definition of acute versus delayed? Time of onset, right? Work through the problem set. Everybody kind of where I'm tracking. All right. You said all right, so I believe you. Then you're in the 4-HT, yeah, you might want to know that. Just looking at some labs, what does this tell you? Anemia. Macrocytic anemia. No. All right. And I don't know why this is in here, but we'll take advantage of it anyway. 35-year-old, somebody, ER, symptoms, fatigue, shortness of breath. What's fatigue and shortness of breath in this class? Anemia. Yellowish tint, what does that tell you? Hemolysis. You guys got this. Received a blood transfusion 3 days ago. Yeah, so jaundice, yep. What's your hemoglobin telling you? Low, so you got anemia of something, right? Elevated retic count. Indirect bilirubin increase, right? So you can work through that problem set. As long as you can interpret these labs, interpret these presented signs, you'll do fine, okay? And that's the bulk of this test. So I first order questions, second order questions, third order questions. They got this, you gotta come up with the disease process, and then the treatment might be the answer, right? So the last class, I had some questions on there like, yeah, we didn't expect any first order questions, so that's why we failed. Like, really? Is that a thing? So yes, there are first order questions, not to insult your intelligence being seniors, right? There may be one or two of those, but the bulk of it is, can you work through a problem set? There's your whatever, there's your labs, right? Again, for the last time, must be able to interpret labs. Right. Any questions? I got it.
Sir, will this be uploaded afterwards?
No way. No way. Because this is all about being able to talk through the problems. You guys,
Can you just click through from beginning to end?
where's the off switch? How about that? So, and serious, all right, if anybody in their mind, like you go through looking at a lab, looking at a problem set, and you can't walk from beginning to end on it, come find me. Alright, so this test, everybody don't go getting 100. Alright, I'm gonna look really bad as an instructor if everybody aces this. But somebody be willing to settle for a 98. I need a couple 98s just to level stuff up. So you guys got it. Alright. And any questions, seriously? Everybody good? Alright, I gotta be at another spot in a minute. Thanks, sir. Yeah, those of us on this, but